Good evening. I am Roberto Santamaria, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital's Community Health Initiative. This is a special edition of the Nantucket Pulse program that will air weekly covering the coronavirus impacts for the island and will provide urgent updates as they unfold. We are recording today's episode at 2 p.m. I am happy to welcome friend of the show, Gary Shaw, CEO and President of Nantucket Cottage Hospital, Kevin Komick, Executive Director of Senior Living Residences at Sherburne Commons, and Janet Schulte, Director of Culture and Tourism for the town of Nantucket. Gary will share a statement from the hospital. Then I will discuss the work of the town's COVID-19 Economic Impacts Task Force and the Economic Impact Survey that shows just how much the pandemic has impacted local businesses with Janet. Finally, I will speak to Kevin about the challenges of protecting an organization full of folks over 65 years young, which of course are at high risk for COVID-19. First, let's begin with some community updates. The governor released the 4-phase approach to reopening Massachusetts this week. The first phase begins on May 18th, when the stay-at-home advisory is expected to end. Phase 1 is named START and will allow limited industries to resume operations with severe restrictions. Phase 2 is named Cautious and will permit additional industries to resume business with restrictions and capacity limits. Phase 3 is named Vigilant and will see even more industries open with guidance from the Commonwealth. Phase 4 is named Our New Normal and will start once a vaccine and/or therapy manages the virus. The start date of each phase will be determined by government and medical officials. Massachusetts can regress to a previous phase if conditions warrant it. The goal of both the Commonwealth and of my department is to avoid this regression, especially in the summer. By continuing efforts to stop the spread, such as wearing masks, social distancing, and implementing clear workplace sanitation standards, we can decrease the chance of moving backwards. To support the long-term plan of a phased reopening, the Commonwealth might institute, quote, focused interventions to prevent local outbreaks from spreading, unquote, applied to certain towns or types of businesses. It has created a mandatory workplace safety standard that applies to every business in Phase 1. They include social distancing measures, hygiene requirements, disinfecting steps, and more. To learn more, visit the link on your screen and in the description. On May 14th, the governor announced plans to boost overall testing capacity to 45,000 daily tests by the end of July and to 75,000 by December. The Commonwealth will expand testing to focus partly on residents and patients in high-risk congregate settings like state hospitals, group homes, and correctional facilities. Plans also call for randomized testing for surveillance purposes as part of the Community Tracing Collaborative's efforts to track the spread. The plans also seek to reduce test results turnaround to next day or even same-day responses. This expansion comes after the National Guard has been tasked with conducting widespread testing for staff and residents of assisted living facilities. Yesterday, the National Guard was at Sherburne Commons administering tests to protect the residents there. The Commonwealth continues to work on acquiring personal protective equipment for frontline workers. The Commonwealth has relaxed its closure policy for non-essential retailers. Now, up to 3 employees for businesses 10,000 square feet and smaller may go to the store to package, ship, or deliver orders. All deliveries must be no contact, so a local business could drop off an item to a customer's porch, mailbox, and so on. All employees must stay 6 feet apart and wear masks. Also, the store must have easily accessible hand sanitizers and hand washing facilities. No sick employee should come to work, and everyone should check his or her temperatures and stay home if it rises above 100 degrees Fahrenheit. If your non-essential business does not have a brick-and-mortar store and all workers can maintain social distancing, then it may continue operations. There has been some confusion about whether customers can enter stores other than pharmacies and grocery stores on Nantucket. The Board of Health intends to clarify that question at its meeting next week. The Board of Health issued emergency orders number 8 and number 9 on May 11th. Order number 8 allows all construction projects that receive the permit before March 20th and have no more than 6 workers on a site at a time to resume operations. Plans with larger crews can apply for a waiver from the building department if there is a strong need. However, Building Commissioner Paul Murphy has approved these requests sparingly. He said to the Select Board that several crews have asked for a waiver to work on large homes. His response was, quote, "I haven't found that is sufficient reason to grant additional workers. Everyone feels that their job is unique and large is kind of subjective. It would be tough for me to do that fairly. So, for the moment, I've been denying those types of requests." Unquote. Crews with multiple people need to register with the building department. Single-person jobs no longer have to do so. Construction can resume, regardless of permit date, for houses that contain dwelling units subject to a deed restriction limiting ownership or rental to households earning 150% or less of area median income. Essential work, like emergency roof repair, can also proceed regardless of permit date. The two differences between Nantucket's construction restrictions and the Commonwealth's are in the limit of 6 workers and the restrictions on projects with permits after March 20th. Order number 9 expands the list of landscaping projects eligible to resume as long as they 1. Apply to and receive approval from the Department of Health or Natural Resources, or 2. For properties of 5,000 square feet or more, no more than 4 workers report to the premises at the same time, and for properties of 5,000 square feet or less, no more than 2 workers report to the premises at the same time. The main difference between Order number 9 and the Commonwealth's restrictions is the lower limit of workers on the island. The town makes clear that sick employees should not report to work. Both Commissioner Murphy and Natural Resources Department Director Jeff Carlson have reported honest cooperation among the companies getting back to construction and landscaping work. Both plans are available on the town's website. Translations are provided in Spanish and Portuguese. Town buildings and offices will start to open on May 18th, but some places might remain closed for a few more days. The police station will open at that point. Town Manager Libby Gibson recommends calling the department you intend to visit before arriving. Your request might be handled over the phone or simply need you to drop off items in a drop box outside of the building. Calling eliminates the chance of driving to a closed building. The town government created the COVID-19 Economic Impact Task Force to hear from representatives from various island businesses to learn about the pandemic's impact to them and to highlight resources and policy changes that are relevant to them. Organized by the Novak Consulting Group, the task force met with representatives from 8 sectors of local industry. After hearing so many different viewpoints, certain requests began to emerge. They can be divided into 4 categories. Businesses want clear and consistent communication with the town and public. For example, they want the government to inform them about resources and to have consistent, up-to-date signage for the public. They want creative use of outdoor spaces. This idea can take many forms, such as curbside delivery, sidewalk service, new traffic management, and additional parking. They want guidance regarding best cleaning and sanitation practices. They want to know what the industry-specific protocols are and where to get personal protective equipment. They also want town and Commonwealth guidelines to align more closely. They are asking for a review of 2020 permits. They suggest that 2020 permits could be grandfathered into 2021. The COVID-19 Economic Impact Task Force also works with the EBP consulting firm to survey over 440 businesses that represent an estimated 42% of all establishments on the island. The findings confirm a steep decrease in businesses across nearly every sector of the island. Nearly 90% of participants were for-profit businesses, and the rest were nonprofits. The most common industries to respond were in the construction and trades, retail service, food service, and hotel and lodging. By late March, quote, no commuting or shopping was taking place as people began to self-quarantine, unquote. You can see on this graph showing that the number of vehicle miles traveled on this island spikes up and down in early March, but by mid to late March, the amount is nearly 0. At the time of the survey, which was over a month ago, only 0.9% of respondents had ceased operations. However, 89% of respondents expected to lose at least 25% of their revenue through June. 35% expect to lose more than 75%. And less than half, or 46%, felt that they had an adequate amount of cash on hand to handle the drop in revenue. In order to help fill the gap, 2/3 have applied to federal, state, or local aid during the pandemic. Most commonly, they applied to the Small Business Association programs like the Paycheck Protection Program and the Economic Injury Disaster Loan Emergency Advance. The most common cost-cutting responses of the respondents were closing operations temporarily at 56%, applying for a business loan or grant at 52%, and delaying seasonal opening dates at 38%. For that question, multiple options could be chosen. The data makes clear that the financial pain is growing. Over 60% of organizations say they must receive support in the next 60 days. The most commonly requested form of support? A clear majority want financial support such as grants, loans, delayed rent payments, and delayed tax payments. The budget for 2021 has gone through major changes. In order to anticipate lost tax revenue due to the pandemic, the town has created a catastrophic plan that assumes over $5 million in lost income. In order to absorb that blow, the budget calls for nearly $2.2 million in cuts. The cuts include not contributing to the other post-employment benefits fund and making, quote, comfortable cuts to the town's health insurance costs and reducing the school's budget. The cut will largely be done through salary costs. However, the school will still receive extra funding for updating some of its dated technology. An overview of the cuts can be seen on your screen. This plan will still leave a deficit of $3.4 million. Let's finish tonight's updates with the lifelines to the island. The Steamship Authority is bringing back the high-speed ferry for Memorial Day weekend from May 21st to the 26th. The schedule is being displayed on your screen right now and is available on their website and at the link in the description. The company is also making slight changes to its car ferry service. The new schedule starts today and can be seen on your screen right now and on their website, as well as via the link in the description. Highline Cruises is adding 3 new departures to their regularly scheduled 5 daily trips. These additions start today and continue until at least May 21st. The full schedule can be seen on your screen and at the Highline's website and via the link in your description. Please note that a few Highline ferries will not run on May 16th and 17th. These exceptions are on the schedule. Now, I would like to welcome Gary Shaw with a special statement from the hospital. Welcome, Gary.
Good evening. I'm Gary Shaw, President and CEO of Nantucket Cottage Hospital. First, I want to take this opportunity to thank the island community for the incredible support we have received at the hospital. We have had so many gestures of goodwill, not to mention gifts of food for our staff and contributions to our response fund. It has been heartwarming and humbling for everyone at the hospital. So once again, thank you. We can't say it enough. Today, I want to emphasize to the community that Nantucket Cottage Hospital is open, safe, and ready to provide care for COVID-19 and non-COVID-19 medical issues. Like other hospitals around the country, Nantucket Cottage Hospital has seen significant decreases in patients seeking care for serious medical issues or necessary treatments. Surveys have shown that some patients are reluctant to access the health care they need due to fears of acquiring COVID-19. If you have an urgent medical concern, we encourage you to contact us. Please don't delay your care. Your health and safety are our utmost concern. Please know that Nantucket Cottage Hospital has taken numerous measures to ensure it is safe for all patients to come to our facility for their care. In the ER and on the inpatient floor, we have designated a high-risk zone for confirmed COVID-19 patients and patients under investigation for the infection, while those who are coming for all other health issues are isolated from them in separate areas, preventing any cross-contamination. Additionally, the physician's practice at NCH is open for both in-person appointments and virtual visits with secure Zoom technology. Both our patients and providers are finding that virtual visits are a useful and enjoyable way to connect during this time. You can learn more about virtual visits on our website. Same-day medical appointments for urgent health issues are also available by calling 508-825-1066. So again, please do not delay care or ignore a pressing health issue. Nantucket Cottage Hospital is open, safe, and ready to care for you. And now a note on testing for COVID-19 at the hospital. Infection control experts have been collaborating with colleagues across our system to continually evaluate and update our COVID-19 testing criteria based on an assessment of clinical priorities and our testing capacity. Just over 2 weeks ago, the testing criteria at our drive-through evaluation site at the main entrance of the Nantucket Cottage Hospital were loosened and now include all patients with active COVID-19 symptoms, essentially those with any type of cold symptoms at all. This new loosened criteria include at least one of the following signs or symptoms consistent with a viral respiratory syndrome: subjective or documented fever, a sore throat, a cough, a runny nose or nasal congestion, shortness of breath, muscle aches, or loss of sense of smell. And with those criteria loosened, as I just noted, we're encouraging anyone with one or more of these symptoms to come to our drive-thru for an evaluation by our clinical team. There is no need to call ahead. One other note relates to a serology test that we are trying to get approval for on Nantucket. We've been working diligently with the Broad Institute, MIT, Harvard, and the Mass General to create a serology testing environment that would allow us to do a certain number of tests per week for a possible framework of 6 months. Those tests would not require individuals to specifically come to the Cottage Hospital for testing, but would be done through protocols that we already have in place in our laboratory in using biomedical substances such as serum or plasma. We are working to do a complete research study that is on tap to be evaluated today by the Nantucket Cottage Hospital Human Research and Education Committee. The next steps will be to take that to the Mass General for review and then to an IRB. And if approved by those contingents, then we would be seeking funding from the island to help us fund the resources to do the testing. We hope that we can move to get this approved and begin testing for serology antibody tests sometime towards the next week or by the end of the month. So more to come on that as testing and serology opportunities evolve. We thank you for your patience, and I want to ask you again to continue to do those things that make the island safe. That is, de-densify, social distancing, wear masks. This is not the time for parties or large groups. Follow the governor's, the state, the local recommendations on how to stay healthy. And I'm sure that you'll enjoy a summer on Nantucket, a little bit different than in the past, but no doubt full of sunshine and opportunities with your loved ones, families, and friends. Stay safe, wash your hands, and thank you for this opportunity.
And now we have Dr. Janet Schulte, Director of Culture and Tourism for the town of Nantucket. Janet, how are you today?
I'm great. How are you, Roberto?
So I'm just going to go ahead and jump right into questions.
Okay.
I know there was a recent survey done. So what do you think are the most important findings of this survey?
Yeah, that survey was commissioned by Remain for the Economic Impact Task Force that the town had, and it was done as a baseline to figure out what the immediate economic impact of the closures were back in March. The survey was actually implemented in April, and I think the most drastic findings were at that point, 50% of employers had laid off people or furloughed them. We saw significant concerns about revenue reductions over the first 60 and 90 days. And we had already seen some permanent closures, something like 9 or 10, 1 month in. So it'll be interesting when we run this again to see how that has grown or changed.
Yeah, that's a scary thought. So this survey provides useful information to many different people. Is there a group that it is especially meant to influence?
Well, now that we've morphed the Economic Impact Task Force, both the one that I was running for the town and the one Christy Ferrantella was running for the chamber, into the Economic Recovery Group, we're going to use it as one of our metrics to see if some of the programs and activities we put into place and changes that we put into place have an impact, positive impact or a negative impact on businesses coming back as we move into a reopening or rebooting phase.
And do you see any indication about what these findings might mean for businesses before and after the summer?
I think they're going to be general indicators of the effectiveness of their own decisions. I think some folks have used that information or those questions to reflect on whether they're going to open at all, or have used that as they move forward to think about how they're going to open it all. And I think when we get on the other side of it, certainly got to see some changes that may not have economic impact, but will certainly have impact on the way businesses operate.
Gotcha. So besides the top 4 requests summarized in the COVID-19 Economic Impact Task Force Roundtables report, it's a mouthful, were there any surprising insights provided by some of the industry representatives?
I was very impressed with the degree of cooperation and collaboration that I heard in those 8 roundtables, and again at the task force meeting yesterday, that people are really willing to find ways to work together, to help one another, to listen to each other, and to share information, to come up with strategies to survive and in some cases flourish in this environment.
We're hoping that everyone can flourish as much as they can. And what are the plans for the next survey? How will it be different from this survey?
I think we'll ask some of the same questions to get some economic indicators, but I suspect that we will add some questions about how have people pivoted, what steps did they put into place, which ones of those were successful, which ones weren't successful, and what plans they have for moving forward to continue to move forward. Because these as we take these dips in the water every 6 or 8 weeks to find out, we're going to start to see some trends and have a better grasp on how to help or provide supports for people to come back.
So I guess a lot of this is the linchpin waiting on the governor right now too, I imagine.
Yeah, we all know, as we all keep saying, that it's what the governor is going to say about who reopens, how or when, and how quickly or slowly that happens. And I hear a lot of people really eager to open the doors and throw the light switches on, but we all are pretty sure that.
That's actually a great connection, more like a dimmer than a switch. Well, Janet, those are all the questions I have for you today. If we're looking for more information, where can we find that?
Well, the reports and a blog post about the survey are on the town's website, the COVID-19 page, under a tab called Resources for Businesses and Nonprofits. And there's a something called the Economic Impact Task Force, and those reports are in there, and you can find them all and read them all. That document that we did from the roundtables, 47 pages of verbatim comments from those 8 hours of meetings. It's fascinating.
Well, thank you. And thank you for joining us today, Janet Schulte from the Culture and Tourism Department. We really appreciate you taking your time and talking to us today. So with us today, we have Kevin Komick from Sherburne Commons. How are you doing today?
I'm great, thanks, Roberto. How are you?
Pretty well, thank you. I really appreciate the ask. So people have been asking a lot about how a lot of the island organizations are handling the COVID crisis. So I'll go ahead and jump right into a few questions we have for Sherburne Commons. So what is Sherburne Commons doing to prevent the spread of COVID-19 there?
Well, I think we're doing a lot of different things, Roberto, and I would be remiss if I didn't say that we're absolutely thankful to everything that the island has done, because it truly is a team effort. So we're only as good as what folks are doing outside of Sherburne Commons as well. So we're pleased with the teamwork on the island. But specifically to us, we are an assisted living community and an independent living community. So we've got a number of local organizations and regulatory agencies and state and federal agencies, state agencies that dictate some of the things that we need to do. So back as early as early March, we stopped allowing visitors to the community, which is really kind of counter to what you do in a senior community. So that's been difficult, but necessary. Families and loved ones have been very supportive of the fact that we're trying to keep their loved ones safe, but also at the same time, being I think disappointed that they aren't able to see their moms and dads and grandparents. So that was really the first. About March 10th, we actually started screening visitors, and by March 13th, based on an order from the governor, actually, in the Executive Office of Elder Affairs, we stopped allowing visitors into the community. So on the inside of the community, we've redoubled our efforts on cleanliness. Sherburne Commons is always, from an aesthetic standpoint, I think has been a beautiful campus. But you don't always realize what goes behind that, all the cleaning, and our cleaning crew has redoubled their efforts to make sure that high-touch areas are cleaned. We've done a lot of education with staff and residents about social distancing, and now actually we're all wearing masks in common areas, and really kind of following the direction of the folks in town and in the state.
So I'm curious, actually, along those lines, what was it like for the staff when the decisions came down to ramp up for safety measures to ward off this virus?
Well, I have to say, I have always been very impressed and proud of the staff here at Sherburne Commons. They have always put our residents first. So there was virtually no resistance to just about anything we've asked them to do. I think, like with the visitors, there's been some disappointment that we can't get quite as close to our residents. It really is truly a family. It's home for about 70 people, and I think people are used to hugging and touching and being close to one another. That's what makes a place like Sherburne Commons such a wonderful place. So as much as the staff have embraced the things that we need to do to keep people safe, I think there's a little bit of a sense of sadness and really just disappointment that we can't do some of those things. Although I can tell you the staff have gotten very creative. We do Zoom bingo. We have, in fact, as I told you, I have to rush off to another meeting. That's our Zoom bingo meeting this afternoon at 3:00. We actually have residents that are down south that heard about our Zoom bingo and have joined before they've even gotten back from their winter houses. So that's worked out pretty well. We do Zoom cocktail parties now, and so a lot of people are being creative and cooperative. And so as much as it's a little bit difficult, I think people have embraced what we need to do to keep our residents safe.
Wow, those sound like fun, actually.
I'll send you the link, Roberto.
Sounds good. Is the Commonwealth helping your organization prevent this spread in this population?
I think they have. I've been very impressed with the governor's response. I think specifically we hear a lot about nursing homes, but he has included assisted living and independent living communities in a number of things. And in fact, yesterday the National Guard was here. We had requested, based on the offer from the governor and the Department of Public Health, to have all of our residents and all of our staff tested for the virus. And we have fingers crossed that the results come back as positive, meaning they're all negative, like the Our Island home did. So that they really put their money where their mouth is and send people out to help us do that. We get updates from the governor's office and the Office of Emergency Management every day with suggestions on things to do, and we're trying to follow those. So I felt that there's really an effort on the part of the state and on the town, quite frankly, to make sure that we know where the answers are, if there are answers. And I think that's there aren't necessarily all the answers yet, but there's certainly some strong suggestions. And I'd be remiss if I didn't mention the town. The town's been great. Specifically, Rachel Day. She's kind of our contact. I think she was kind of assigned to be the contact for senior services on the island. And that certainly not everything is clear when it first comes out. And I've been very pleased with any time we've called with questions, we've been given clarifications. And the 3 months that this has gone on, I have yet to have somebody say we're too busy to answer your question. So I think there's it's been a terrible time. However, I think there's also been some real silver linings in people in town.
Oh, that's great. Oh, great. We really enjoy working with you as well, and Rachel's been very great with us as well. How have the visitors responded to these restrictions? I know it's really tough because visitors want to visit their family.
Well, that, quite honestly, that has probably been the most difficult part. And my mom lives in a community like this, and I haven't seen my mother since January. And that's hard for a family member.
No, it absolutely makes sense. My mother right now is stuck in Costa Rica because of the travel ban in a facility right now, and my family has been separated for 4 months now. So it's very difficult for a lot of us.
Our families have been great, though. They've really supported us. They've been, because they get frustrated. Why can't we see my mom? Why can't we? And so there's certainly tension. And again, I think that there's the good part is there's been a real feeling of we got to do this together.
Yeah. No, absolutely. So along those same lines, now that after 7 weeks of a stay-at-home advisory, what is the mood that you're seeing among the residents as well?
Well, I'll tell you, I'd be lying if I didn't say there aren't a few people that are crawling, that are climbing the walls like all of us. It is hard. It is, and believe, I tell the residents all the time. I said, if you remember when you had kids, just like when my kids were small, and you used to say, "This hurts me more than it hurts you." It really is true. I can't tell you how many times I have to tell people no. Move away. Don't get so close. Put on your mask. And it's hard. It is so hard, and proud of the residents. But it's hard. It is the joy of a community like this that we get together. So we can't is just brutal.
Yeah, and your residents has definitely lived through a lot. Are there have any of them shared their experiences with you about this pandemic?
Well, they have. It's for like all of us, and I think unless you're close to 100 years old or more than 100 years old, you don't know about the epidemic of 1919. So nobody, even as old as 100, has lived through something like this, and I don't think any of us can quite get our heads around the fact that we can't see it. And I think that's the frustration. I have a couple of tough 90-year-old women here that say, I lived through the Depression, I'm going to be fine. And it's hard to have to say to them, I know you'll be fine, but your neighbor might not be if you breathe on them, And so, we have those discussions all the time. How do we get it across to folks that really it's their responsibility to keep each other safe?
Yeah. No, absolutely. It's definitely a matter of social responsibility and personal responsibility. And hopefully we can all go back and see our families soon. I know my family is all in Central America, and I have a family in Florida, and I have a family, my father lives in Indianapolis, so it's my mother and my father live in Indianapolis, but my mother was stuck overseas visiting her family. So it's been really difficult, and we're all working hard to connect in these times. Any final thoughts, any final wisdom that you've been seeing in Sherburne Commons that you would like to share with the public?
Hang in there. I think as long as we keep the same goals to keep each other safe, and I really want to thank the community, the folks that have supported us. I would probably for me there's been so many people that have supported us, but there is a group of people in town that are sewing masks for us. Two young women whose husbands are firefighters, Allison Mitchell and Aisha Barber. And the mask functionally had been great. And so just that alone has been great. But the the way they make us feel is great. You know, they're
fantastic.
Yeah, one other person to thank, by the way. We
Yes, sir.
we would not have been able to get the testing done by the National Guard, because we're not a healthcare facility. We don't have a physician. Dr. Pearl stepped up and has helped us through the whole process. She's been great.
Yes. No, Dr. Pearl and Gary at the hospital has been really, everyone at the hospital and our Island home, Sherburne Commons, we're in your debt. So thank you so much.
Thanks for having me.
We will continue to provide you with updates on the coronavirus and impacts for Nantucket. Please tune in to Nantucket Pulse, a wellness segment series with new episodes each week. Hosted by Natalie Seminaro, it's designed to connect our viewers with local health professionals that can help us take care of ourselves and others around us. You can watch on Channel 18 and nctv18.org. Please share this with friends and family. It's important that communications remain in place as events continue to unfold and we all remain connected. It's crucial to get your facts from local news sources such as the Inquirer and Mirror, 97.7 AC-FM radio, and NCTV Channel 18. Please stay tuned to see a special message from our essential workers from the community. I am Roberto Santamaria, the Director of Health and Human Services for the island of Nantucket.
We want to thank all the essential workers and medical professionals
and first responders and town employees and stop and shop workers and
the teachers who are working remotely, people who are all doing what they can to save us while we do what we can by staying inside.
We are so very appreciative and we'd like to clap for you. Thank you for everything you're doing for us. Thank you.
Thank you.
Thank you.
Thank you.